Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mr. Johnson. I'm Dr. Smith. How can I assist you today?
Thank you, doctor. I came in for a full physical examination.
Great. It's a pleasure to meet you. Is this our first consultation?
Yes, doctor, this is the first time.
All right. Before we dive in, do you mind if I jot down some notes?
Go ahead, doctor.
When was the last time you had a complete physical examination?
About 1.5 years ago, I think.
And what prompted you to schedule this one?
I've been experiencing frequent headaches, and they seem to be getting worse over time.
Frequent as in daily or less often?
Almost daily now. They started about 6 weeks ago, and they're getting more severe.
Could you describe the sensation and the location of these headaches?
They start at the top of my neck and spread forward to the front of my head, sometimes causing throbbing pain.
Does it affect both sides of your head equally?
Yes, doctor.
Is there any particular time of day when the headaches are worse?
It's mostly bad in the afternoon, especially if I've been looking at screens all day.
Have you noticed anything that relieves the headaches?
I take aspirin, which helps a bit, but doesn't completely relieve the pain.
How many aspirins are you taking daily?
About 8 aspirin a day, 2 at a time.
That's a substantial amount of aspirin. Have you experienced any recent accidents or traumatic events that might be related to the headaches?
I had a minor car collision about 2 months ago. I didn't think it was serious, but my headache started a week or so after that.
Was your head jerked or impacted during the collision?
I remember my head snapping forward and then back, but I didn't hit it on anything. They called it a soft tissue injury at the time.
And you didn't seek immediate medical attention after the collision?
No, I felt a bit sore, but otherwise fine.
How is this affecting your day-to-day activities such as work?
It's becoming a hindrance. I'm a computer programmer, so screen time is unavoidable, and the headaches make it tough to concentrate.
Have you missed any work days because of this?
I've had to take a couple of half days. I can't afford to miss much work, but the headaches are making it difficult.
This is concerning, Mr. Johnson. Given your history and the increasing severity of your symptoms, we'll have to conduct some further tests to better understand what's happening. I'm particularly concerned about the correlation with your recent car accident.
Thank you, doctor. I appreciate your help. I just want to figure out what's going on and how to treat it.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. Please have a seat. What seems to be bothering you today?
I have been diagnosed with type 2 diabetes, hypothyroidism, and occasional migraines. Recently, I've been feeling extremely fatigued and had an episode of palpitations last night. It was quite unsettling.
I see. Can you tell me your age?
I'm 47 years old.
Do you smoke or consume alcohol?
No, doctor.
Have you experienced any nausea, shortness of breath, or chest pain recently?
I haven't had nausea or chest pain, but I did feel a little short of breath last night during the episode.
Can you recall your previous medical history for me?
Sure. Along with type 2 diabetes and hypothyroidism, I also had gallstone removal surgery in 2018. I have been experiencing migraines for about 10 years now.
What medications are you currently on?
Metformin, levothyroxine, sumatriptan for migraines, and occasionally ibuprofen for pain.
Are you allergic to any medications?
I'm allergic to penicillin.
Very well. Your vitals today show a heart rate of 88, respiratory rate of 18, blood pressure of 138/88, a temperature of 98.7 degrees Fahr, and oxygen saturation of 97% on room air. On examination, there's some mild swelling in both lower extremities, no specific cardiac murmurs, and no jugular venous distension. Lab results show hemoglobin A1C at 7.3%, TSH 6.4, and electrolytes are within normal limits, except for a slightly elevated cholesterol level. EKG shows sinus rhythm with occasional premature ventricular contractions.
What does that mean, doctor?
Based on your symptoms, lab results, and the recent episode of palpitations, along with shortness of breath, I would like to order a 24-hour Holter monitor to evaluate your heart rhythm continuously. We also need to adjust your medications, particularly for diabetes and hypothyroidism, as your levels are not optimal.
What about the palpitations?
Palpitations can sometimes be associated with uncontrolled diabetes and thyroid issues, so optimizing those might alleviate the symptoms. However, the Holter monitor will provide valuable data on what your heart is doing during these episodes. We may also consider a cardiology consult based on the findings. I'm also going to order a lipid panel and refer you to an endocrinologist for better thyroid management. We need to get a grip on your overall condition to improve your symptoms and reduce any potential risks.
Thank you, doctor. I was really worried.
Health issues can indeed be concerning, but you're taking the right step by addressing them. Let's work together to improve your health. We will schedule a follow-up appointment to review the results and decide on the next steps.
I appreciate it, doctor. I'll get those tests done and await further instructions.
Great. If you experience worsening symptoms, seek immediate medical attention.
Will do, doctor. Thank you.
You're welcome. Take care and see you at the follow-up.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Mr. Smith was admitted 2 days ago for a gallbladder removal surgery. The surgery was laparoscopic and went without any complications. He's 45 years old, otherwise healthy, with a history of mild hypertension, which is controlled by medication. He's allergic to penicillin. Diet is currently clear liquids and will advance as tolerated. His main issue is postoperative pain, which we're managing with IV analgesics, and he'll be transitioned to oral pain medications soon. Vitals have been stable, no signs of infection, and the surgical site appears clean. He has a Foley catheter in place and is making good urine output. His 20-gauge IV line is in the right arm, and he's receiving normal saline at 25 milliliters per hour as maintenance fluid. I administered 4 milligrams of IV Zofran for nausea around 7 a.m., and it seemed effective.
Now look at question 26.
I want to applaud everyone for their efforts in maintaining a sterile environment in our facility. Recent audits have shown our hospital has a much lower infection rate than the national average. Nonetheless, there are areas where we can improve. Data suggests that hand hygiene compliance tends to dip around lunchtime, likely due to the rush. We need to be vigilant regardless of the time of day. Also, we've noticed an uptick in hospital-acquired infections in the ICU, so extra precautions need to be taken there. Please be extra careful with the disinfection of any equipment, and remember to always wear PPE according to guidelines. Lastly, we've had a few close calls with antibiotic-resistant bacteria. Ensure that you're not only looking for signs of infection, but also conducting the necessary tests to determine antibiotic efficacy. Keep up the good work, but remember, infection control is an ongoing process.
Now look at question 27.
All right, let's go through our new arrivals. Jenna, would you like to start?
Of course. We have Timmy Johnson in room 12, a 10-year-old boy admitted late last night for severe asthma exacerbations. He's been requiring frequent nebulizer treatments, and his oxygen saturation fluctuated between 88 to 93%. He has a past medical history of recurrent asthma attacks. We've moved him to the pediatric intensive care unit for close monitoring. We'll be giving him treatments every 4 hours and checking his oxygen levels regularly.
Okay, that sounds good. I'll review his case during my rounds. Are we planning any discharges?
Yes, Emma Parker in room 8 is ready for discharge. She came in with dehydration due to gastroenteritis, but has been tolerating oral fluids well. A social worker has been arranged to discuss home care, and she'll be discharged with a care plan and follow-up appointment.
Excellent. Let's go over that in our discharge meeting later today.
Now look at question 28.
Mrs. Williams, what brings you in today?
Well, I've been having trouble managing my blood sugar levels. They're a bit erratic, and I don't know what I'm doing wrong.
Have you been following your diet and medication regimen?
Yes, I'm doing my best, but sometimes life gets in the way. I also get so tired, and that makes it hard to exercise.
Exercise is an important component of diabetes management. Can we aim for at least 30 minutes of moderate exercise most days?
I can try. It's hard, but I know it's important.
Good. I see that you had some episodes of hypoglycemia last year. Anything recent?
No, but I'm always scared it will happen again.
Let's adjust your insulin regimen then. I'll also refer you to a dietitian to help with meal planning. Keeping a food diary can help us identify any triggers for your erratic blood sugar levels.
That sounds like a good plan. Thank you.
Now look at question 29.
So, Emily, how did your shift go today?
I ran into an issue with Mr. Thompson's catheter. I've done catheter insertions before, so I felt prepared, but his was really challenging. There was a lot of resistance, and I was worried about causing discomfort or harm.
Inserting catheters can be tricky, especially with male patients who have enlarged prostates or other anatomical issues. Did you ask for assistance?
I did. Nurse Johnson came to help, and we managed to insert it properly, but it was a nerve-wracking experience.
That's why we're here to learn. Next time, try to recognize when you're in over your head earlier, and don't hesitate to ask for help.
Now look at question 30.
All right. So your mom mentioned you've been having a sore throat and a fever for a couple of days, correct?
Yeah, and it hurts when I swallow. My mom thought it might just be a cold.
Well, your symptoms could be a sign of a bacterial infection like strep throat, especially since you have a fever. I don't see any nasal congestion or other signs of a common cold. Does it hurt to turn your head?
A bit, yeah.
I think we should do a throat swab to rule out strep throat. If it is strep, you'll need antibiotics to help you get better and to avoid any complications. If the swab comes back negative, then it's likely a viral infection and will resolve on its own, but you should still get plenty of rest and fluids.
Okay, let's do the test then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today we're joined by Dr. Emily Green, a leading oncologist and expert in CAR T-cell therapy in the United States. Dr. Green, could you tell us what CAR T-cell therapy is and why it's considered a breakthrough in cancer treatment?
CAR T stands for chimeric antigen receptor T-cell therapy. It's a form of immunotherapy where we take a patient's own T-cells, genetically modify them to recognize and attack cancer cells, and then infuse them back into the patient. The therapy has shown remarkable success rates in certain types of cancers, such as acute lymphoblastic leukemia and non-Hodgkin lymphomas. However, it's not without its challenges, including potentially severe side effects and high costs.
What kind of challenges are we talking about here?
One major concern is a condition called cytokine release syndrome, which is a severe inflammatory response that can occur after the infusion. It requires careful monitoring and quick intervention. The second issue is the cost. This is a highly personalized treatment and can cost upwards of $400,000 for a single infusion, making it inaccessible for many patients.
Could you share a particular patient story to shed light on how CAR T therapy works?
Certainly. One of my patients, let's call him Steve, was diagnosed with relapsed B-cell lymphoma. Traditional chemotherapy regimens were ineffective, so we decided to proceed with CAR T therapy. We harvested his T-cells, sent them to a specialized lab for genetic modification, and then infused them back into him. Within a month, we saw a dramatic reduction in his tumor burden. He did experience cytokine release syndrome, but managed it effectively with medications. It's been over a year now, and he's in complete remission.
And what about late-stage patients? Do they have any options with CAR T therapy?
Unfortunately, not all late-stage cancer patients are suitable candidates for CAR T therapy due to various health complications or because their cancer types are not responsive to current CAR T-cell designs. I treated a patient, let's call her Mary, who was in her late stages of pancreatic cancer. Unfortunately, we do not yet have CAR T therapies that are effective against this type of cancer. She was enrolled in a palliative care program to manage her symptoms.
What future developments are in the pipeline for CAR T therapy?
There's a lot of exciting research happening. Scientists are working on off-the-shelf CAR T cells from healthy donors as a less expensive alternative. There are also trials aiming to expand the range of cancers that can be treated, like solid tumors. Regulatory frameworks are also evolving to fast-track these therapies for public access. But all of this takes time, money, and rigorous testing.
Well, Dr. Emily Green, thank you for shedding light on this fascinating and complex subject.
Thank you for having me. I believe that CAR T therapy is just the tip of the iceberg in cancer treatment advancements, and I'm optimistic about what the future holds.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Sarah Johnson, and I am a certified genetic counselor here at the University Hospital. Today, I'd like to talk about the fascinating world of genetics and personalized medicine, and I'll illustrate this with a compelling case study. But first, let's explore what genetic counseling is all about. Genetic counseling involves interpreting genetic tests, family history, and medical records to assess the risk of inherited conditions and diseases. Unlike traditional therapy, which might address a broad range of emotional and psychological issues, genetic counseling is highly specialized. While doctors may ask, "What are your symptoms?" my first question usually is, "Tell me about your family history." Now let's move on to my case study. I'd like to talk about Emily, a 35-year-old woman who came to me after being diagnosed with breast cancer. Her mother had ovarian cancer, and her aunt also had breast cancer. Given her family history, her oncologist recommended genetic testing to see if she had mutations related to hereditary breast and ovarian cancer, like the BRCA1 or BRCA2 mutations. When Emily first came to me, she was overwhelmed, not just by her cancer diagnosis, but also by the implications of genetic testing. She was concerned not only for herself, but also for her 15-year-old daughter, who might have inherited the same genetic risk. After a comprehensive evaluation, it was confirmed that Emily was indeed a carrier of a BRCA1 gene mutation. This had important implications for her treatment, potentially making her a candidate for more aggressive interventions, like a double mastectomy and oophorectomy, to reduce future cancer risk. Many healthcare providers initially thought it was too much information for her to handle, and that it might detract her from her immediate cancer treatment. But I disagreed. Knowledge is power, and Emily used that information to take control of her health journey. She opted for the surgeries, not just to treat her current cancer, but to significantly reduce the risk of future cancers as well. And what about Emily's daughter? At the age of 18, she can decide whether or not to undergo genetic testing herself, armed with the information and the counseling needed to make an informed choice. Today, Emily is cancer-free and is a strong advocate for genetic testing. She takes immense pride in the fact that her journey might help her daughter make informed decisions in the future. In the world of personalized medicine, patients like Emily make me realize the impact that genetic counseling can have. It's not just about interpreting a test, it's about shaping a path for the future. And it allows individuals to make choices not just for themselves, but potentially for generations to come.